Tonight I'm joined by Jasmine Vasquez and Crystal Boatwright, and we are going to go through labs, what are called the functional medicine labs. So part of what the three of us are learning and incorporating into the practice is the functional medicine view of lab interpretation. So patient comes in and most of the time a major disease has been ruled out by a conventional doctor, a primary care doctor. And that would be conventional lab work, conventional imaging, CBC, comprehensive metabolic profile, chest x-ray, EKG, whatever it is. And usually with that, you can determine if something really bad is happening. And that's kind of where the conventional folks leave it, not to criticize, but the patients may persist with, I'm tired, I'm fatigued, I'm bloating, I don't feel well. They've had a GI workup and nothing bad is going on. And that's where they get frustrated and seek functional or non-conventional practitioner, naturopaths. There's a lot of folks that are doing this. So we're adding this to a conventional practice or a wellness program. You can call it a lot of things. So we're going to go through the big three labs that we order, and it's really to reflect a body systems approach. What we call adrenal lab would be the first one, or adrenal program. That's kind of a broad term for neuroendocrine or HPA axis. It's really focusing on cortisol and DHEA metabolism. And it's really how the person handles the resiliency of the stress response. So we'll go through that a little bit. The GI map, so the adrenal lab is a salivary specimen, saliva. GI map is stool, obviously the gastrointestinal tract. There are some organisms, usually based on PCR, polymerase chain reaction methodology. And it'll show us some things from opportunistic bugs to invasive bugs, yeast, and we'll go through that a little bit. And then the last one is the metabolomics or the organic acids. And this is really looking at, and this is a urine sample. So it's really looking at metabolites. And we'll go through some of these basic examples. So just looking at the metabolites can give you an idea of what's going on with the patient. And then typically we'll prescribe, in addition to lifestyle changes, which is diet and exercise mostly. That's the hard part, getting them to change their behavior. And we'll use supplements in the meantime while we're incorporating all that. So that's the general strategy. And again, fatigue can be anything. So any type of dropping energy can mimic fatigue. The main one we would think of right offhand is, well, something's going on with the mitochondria, the powerhouse of the cell, which produces ATP, and we'll look at that. So just since we're introducing this to our IVC community, why don't we start with you, Crystal, and I'll just pop up the adrenal lab. It's really called the Adrenal Cortex Stress Profile, or ASP, ASP with CAR, the cortisol awakening response. So let's just, and if you want, I can go through a little cheat sheet down here in the commentary of what the morning cortisol level would look at, mid-morning, kind of what it means. You can go through that. The CAR, what it means, at least by the Genova people, the company that produces the labs and interprets them. So just a real high level, Crystal, what is your understanding of how we use the ASP with CAR, salivary? And then we'll ask Jasmine to do the same.
So really from first glance, the patient has a normal curvature and that's expected, but the DEHA is on the lower end of the spectrum. And the first thing that I saw was the CAR. It's 50%. It should be above 50%. So right there, I'm immediately thinking that they're at least a stage 1, stage 2, maybe, just to go upwards, just based on a quick initial glance at that.
And what does that mean when you look at that? What does that mean? You need to explain this to the patient. So explain this to the patient for me.
So it's their body is not able to produce enough response to the normal awakening cycle, that their body is in a stressed state. And if they continue on this path, that they're going to have adrenal burnout. their adrenal glands are not functioning at optimal state. So some people wouldn't even treat it because it's normal, but it's on the lower end of normal. So if we can get ahead of it, then their symptoms of fatigue, brain fog, maybe it helps with their hormones, thyroid, glucose function. A lot of that can be optimized just with the adrenal protocol, focusing on the DHA and the cortisol, since those are pregnenolone. Those are pre-markers for their hormones, their major sex hormones.
All right, Jasmine, how do you explain this to the patient, what you're seeing?
Well, pretty much the same. I would just basically let them know that their adrenal glands are not functioning normally, whereas because due to stress or whatever factors in their life at the moment, they're getting to the point that the adrenal glands are getting tired and they're not going to help them manage their day-to-day stressors. So eventually that is going to cause other problems in the body where they're actually going to begin to feel more tired, more dragged, possibly a little bit of brain fog. I find when I say things like that to them, which is true, they can understand it a little bit better. So I would suggest some of the supplements, which is going to help jump kick them. But I will also let them know that this is not just supplements and for them to be on it forever, that they also have to do part and just find out what time do they wake up? What time do they go to bed? What do they do before going to bed? Things like that to just help along the way.
That's a great point, Jasmine. Lifestyle modifications are vital for stress management, whether it's exercise, yoga, meditation, just learning how to handle what life throws at you in addition to the supplements. So that's a great point.
Absolutely.
So that's all correct what you guys have said. And to explain it to a patient, I think that's probably okay. Now, I'll explain it to you in a little more detail. So the DHEA is low. So we already know they're going to be in stage either 1, 2, or 3. They've got some dysfunction. Even though it's called adrenal, really this is the measure of the HPA axis, the hypothalamic pituitary adrenal axis. It's almost brain dysfunction more than adrenal dysfunction. How would I explain it to a patient? This is looking at your stress level and your resiliency or your ability to cope with it. Broad. Which stage is it? So the car at 50 is, yes, it should be above 50, but 50 is pretty good, right? So that's not bad. And the pattern of cortisol from awakening through the day here, these are 4 different times. It's not quite in the green, so it's not normal, but it's not awful. But the DHA is low. So a stage 1, the cortisol would be high, and a stage 3, the cortisol would be flat. So this is probably a 2, meaning that it's on its way down. So we would treat them with a stage 2 adrenal program. Again, the term adrenal used loosely. And the main supplements are pregnenolone and DHEA supplementation because that's higher up in the steroid production pathway. You're providing substrate, not in big doses. It's in very small doses, really to reset the HPA axis. So it's really dripping in it's a 3 times a day type thing. So throughout the day, you're dripping in pregnenolone and DHEA. So the hypothalamus is saying, or really hypothalamic pituitary is saying, that negative feedback. It's saying, well, cortisol is doing this, but I've got a little substrate, and it just tends to reset over time, and time meaning months. It's not one day to the next. So it's really to reset the HPA axis. Now, as far as the particular time points, if you look at the lab companies' interpretations, the morning here, 7 a.m., okay, the morning. So we're going to go 4 time points, 7 a.m., 11 a.m., 3 p.m., and 10 p.m. So what they say about the morning is cortisol measurement reflects peak ACT-mediated adrenal gland response. Cortisol releasing hormone from the hypothalamus talks to the pituitary, which produces ACTH, which goes down to the adrenal and tells it to produce cortisol out of the cortex. So this goes back to HPA axis. The mid-morning still reflects HPA axis. Afternoon, and this one's glycemic control. So that's why part of the program is we put in lipoic acid for blood sugar regulation. Cortisol, of course, is a glucose sugar. People on prednisone, their sugar gets out of whack, often needing to be treated like type 2 diabetics while they're on it. Evening, cortisol levels at HPA axis. This is just to stress the point that it's not so much the adrenal. This is not what you're telling your patients. This is what you're understanding. If you're telling your patients this is your stress response and you're not coping well, that's really all they need to understand. And maybe we need some further testing to see why. Is it your GI tract? Is it your mitochondria? Is it your something else, toxins? Cortisol awakening response, I like it more down here. CAR involves HPA axis and adrenal support, whereas the elevated levels may be due to stress. I wanted to show you the blunt one. Blunted CAR is seen in clinical burnout, depression. So that would be this guy being flat or just not doing what it's supposed to do, the rise and fall. What is CAR exactly? What does that 50% mean when it says 50? Most literature demonstrates an expected increase of greater than 50% as a reflection of HPA axis resiliency. There's an actual, can't find it right now, what the actual 50% ratio means, but just think of it like that expected increase of greater than 50%. So this should be 50% increase at 30 minutes. Again, it's cortisol awakening response. So upon awakening, you should get an uptick of at least 50% increase. Some of this can just be by getting light in your eyes. If your car is flat, one of the most easy things you can do is as soon as you wake up, go outside, get some sun in your eyes. That's how you start fixing this. All right, let's move on to the next one.
Let me ask you one quick question.
Uh-huh.
When we're looking over to the right where it says salivary cortisol, would you agree or say by looking at the black line that it's not, would you say that they're not coming down or calming down by the end of the day? That
They're still stressed. They're above the green. They're still
Okay.
stressed. It's not horrible, but it's not in the green. So this is high. So what can you do to bring that down? You got to implement your pregnenolone and your DHEA, but what else can you do to bring it down?